Hello, my name is Kathleen Cobb, and I'm a licensed practical nurse working at the Women's Health Clinic at Cheshire Medical Center in Keene. And I am here today to discuss the use of nursing skill matrices for our facility. To get started, I'd like to discuss the need for such matrices. So, as an individual nurse, you are given a nursing license, and this is to verify that you have met all the standards for your license. However, in a facility, you have nurses that range from those who are fresh out of school to ones that have been working in the nursing profession for 10 to 20 years. In that amount of time, the way that we use our skills can change based on evidence-based practice. So, if you are not verifying your nurses' skills as they come into the facility, you can cause a decrease in quality of care for those using outdated or old practices. You can decrease the employee morale, and this can also lead to diagnostic errors. What I'm proposing today is a solution, which is the nursing skill matrices, and I will also discuss the project budget and a conclusion, and I'll leave time at the end for some questions and answers. So for decreased quality of care, well, first let's go over the definition of quality of care. As stated by RAND Corporation in a document that they published, they describe the quality of care is the degree to which health services for individuals and populations increase the likelihood of desired health outcomes and are consistent with current professional knowledge. Now, when they say current professional knowledge, first thing that pops in my mind is the evidence-based practice. When you use a skill that has been run through the mill, as far as people that have tried every means of utilizing the skill to deem which one is the most accurate and least invasive to the patient, that's using evidence-based practice, and that's what I believe our facility should be doing. So with older skills being used, you can decrease the quality of care. For example, older nurses may aspirate prior to injecting a medication. This is a skill that's no longer performed. It's actually kind of frowned upon because it can, first of all, increase the pain level to the patient. It can increase the time spent with the patient, and there's really no need for it, which has been deemed so by evidence-based practice. Newer nurses know not to do this. However, older nurses think that this is still the way we go. So if we use the nursing skill matrix, where it's written down step by step what to do, there's no question. Now, that being said, the two different nurses working on the same floor doing or performing skills differently can lead to a decreased nursing staff morale. This is because of some reasons I could think of would be if one nurse says, no, we do it this way, and another nurse says, well, I was taught this way, that leads to arguments. And nurses working in a clinic, for example, they need to have a really good team ethic. And when there's disagreements between nurses, it's very hard to accomplish that. One thing stated by Bonnie Claire, who has her MSN and she's an RN, is happy employees translate into happy customers, and in healthcare that means happy patients. Therefore, if the nurses are happy, that emulates towards their patients, and it makes the patient's experience that much better. So we want to keep our nurses happy, and I believe by utilizing these nursing skill matrix, it leaves no room for argument, because you would simply pull up the matrix, see how the facility deems that skill should be performed, and that is what you do. There's no argument, there's no it's this way, it's that. It is written down on paper the correct way to perform that skill. Now, another big thing with using older, outdated skills, or maybe like a lot of nurses just coming out of school, when they were in their clinical, they used manual blood pressure machines as opposed to, or automatic blood pressure machines as opposed to manual. Using an automatic blood pressure machine doesn't give you the opportunity to actually dig your hands in there and get dirty, per se, and hear what an actual blood pressure sounds like. So if a nurse comes into a floor, like for example our women's health clinic, we only do manual blood pressures. If a new nurse comes on the floor and she's only done automatic with the machine, she's not going to know how to do that skill. So therefore that can lead to diagnostic errors. She or he could perform that skill incorrectly and actually get either a false high or a false low blood pressure, and both of those can be detrimental to a patient's outcome. If she gets a false high, say, that could lead to a diagnosis of hypertension, which would then end up costing the patient a lot of time and a lot of money, all for possibly nothing, because it may be that they had a totally normal blood pressure, but because she performed the skill incorrectly, there was a diagnostic error. So Time magazine released an article, and they stated that not only were diagnostic-related errors the most likely to result in disability or death, but they also cost $38.8 billion in malpractice claim payouts between 1986 and 2010. I don't know about you, but that's quite a bit of money that I think our facility does not want to spend. So, my solution, nursing skill matrices. And these nursing skill matrices will be up to date. They'll be based on evidence-based practice. They'll be safer. They'll be more time efficient. When I say safer, it's because, as I said, there'll be less room for error, less room for doubt in the nurse's mind as far as what is the correct procedure or the correct way of performing the procedure. They'll be more time efficient because you won't go in there not knowing how to perform a skill and kind of fumble your way through it. You'll go in there with confidence and the ability to perform the skill correctly the first time. This being said, that will increase our quality of care because the techniques will be based on evidence of what is the best technique for each skill. They will be more up to date once again, meaning that they are the most commonly used across the board, and it will provide continuity because a patient will come into the clinic one time and say have their blood pressure checked one way, and when they come back it'll be checked the exact same way. The last thing that we want is for patients to doubt our ability by having it performed different ways, or having one nurse say, no, this is correct, while another nurse says, no, this is correct. That just leads to confusion and separation, and we don't want that in our facility. We want patients to come in knowing that the nurses that are working with them are educated and confident and able to perform the task. And like I said before, this will increase the nursing morale by creating kind of that team dynamic again, because everybody will be on the same page as to how skills are performed. So it leaves no room for argument. Our nurses will be more efficient. There will be decreased diagnostic errors, and the skill matrix will be a valuable resource to them, because anytime they have question or doubt on whether they're performing a skill correctly, they can just simply revert to that skill matrix and see exactly how that skill should be performed. Our budget for this implementation of skill matrices is actually quite reasonable, I believe. The only thing that I can see our facility would have to pay would be for coverage for the nurses during their training. And it's a very short training, and I have that estimated at $200. Our documentation will cost us nothing since we already have the computer software in place. The implementation should cost us nothing because we already have a database that we can make this documentation accessible. So our total budget will be $200. In conclusion, using nursing skill matrices, our facility will increase our quality of care provided. It'll increase our nursing staff's confidence. It will reduce wasted time, and it will reduce facility and patient costs, which in this day and age, that is huge and beneficial to both our facility and the patient. So it's a win-win, if you ask me. And now I will leave the floor open to any questions or comments. Thank you.